Good afternoon, everyone, and welcome to another social emotional workshop. We are going to be talking about suicide prevention today with Adon and Taylor, and they are from let me say it correctly, the American Indian Service Family Service Center. Am I close?
American Indian Health and Family Services.
Health and Family Service Center. Thank you guys so much for joining us. We're so glad to have you.
No problem. Now, yes, let me see if I can share this. Having a bit of a moment. Okay. Okay.
Good deal.
Okay. Okay. So we are the Sacred Bundle Project. We are a youth suicide prevention program based here in Detroit. We work with youth 10 to 24. We come out, that's just kind of like our JITS, our program. So today we're going to kind of talk about what our program does in terms of suicide prevention. Yeah, we'll go ahead and get started. My name is Adon. I've been on the program here for about 3 years now. I'm currently an undergraduate student at Wayne State, and I've grown up in the Metro Detroit area my whole life.
My name's Taylor. I also have worked on the program for just about 2 years now. So me and Adon have been together for quite a while. We have a lot to share about our agency. Our agency has a lot to offer, as well as our program in general. So please feel free to ask questions. We can get any kind of information for you guys for any other agency programs that you need. Yeah, feel free to ask us all the questions. If we don't know the answer, we will try and get it for you guys.
Okay. So just some little bit of basic information. So like we said, we work at American Indian Health and Family Services. So AIHS is one of 42 urban Indian organizations across the US. We are the only urban Indian clinic in Detroit, or in the state of Michigan. And what that means is we service folks of all nations. The last census came out, about 71% of Native Americans don't live on a reservation. So because of that, they don't necessarily have access to primary care, behavioral health, cultural services, and things like that at the same type of rates that those who live on a reservation may have. And that's the purpose that we serve. And our BH department houses a couple different prevention programs. So we have our programs, our Sacred Bundle Project. So that focuses on youth 10 to 24, as well as our Zero Suicide Project, which focuses on adults 25 and up. So in our agency, we do screen anyone over the age of 10.
We also are very conscious of where we are in Southwest Detroit. So we do have Spanish services available. We do have sliding scale fees for those. Anyone can receive our care here at the agency. You do not have to be affiliated with a tribe. You do not have to identify as Native. So our services are open to anyone, and we do try and provide services, like we said, in Spanish, and do community events around here in Southwest Detroit as well.
So just really quickly, so this is just a map of some of the 12 federally recognized tribes here in the state of Michigan. So obviously we're down here in Detroit. So our closest ones are the Nottawasapi Huron Band and Saginaw Chippewa. We do service quite a bit of First Nations people, which are the Indigenous folks of Canada. So now we're going to kind of move into some of our suicide prevention efforts from our program and some of the stuff that we do, and some of the stuff that may be able to be implemented across the board depending on the communities that you're in as well. So at the agency, we're big believers in using cultural teachings as a way of prevention for suicide, alcohol misuse, substance misuse, all types of things. So we offer an array of services like sweat lodges, language classes, drumming circles, baby moccasin making, traditional medicine harvesting, as well as traditional food classes. So kind of learning about what our traditional foods are, ways that our ancestors used them, as well as ways that we can use them now in, modern cuisine or modern foods. So this picture right here, that's the picture of our sweat lodge that we have on site here. So we have right now a schedule going about 2 sweat lodges per month. And they're always the first and third Saturday of every month, as well as all of our classes that we have, like the baby moccasin workshop, and drumming circles and things like that, all go out in our community announcements as well as on our Facebook page and all of that, and they're open to anyone. Some of our virtual cultural activities. So obviously with COVID, it kind of took a toll on the amount of in-person activities that we could offer to our community. So we looked at the next best option, well, the only option, which was doing everything virtually or via Zoom. So we offered traditional storytelling series with our youth, our Native Hope training. We also did a Potawatomi cultural series, bear bundle teachings, and a gathering of Native Americans workshop. Sorry, and then if you wanted to talk a little bit more about the...
Yeah, we really just wanted to offer a space for that community. Community and culture being such a huge part of prevention, and giving that space to people who traditionally were used to having this in person, still, letting them know that we were there for them, the community was there for them, and they could still have these experiences, although a little differently. But that our program was there, that these offerings were there for them, and that they had that space to connect with community, and really kind of help with that isolation during COVID.
Another tool that we have here for suicide prevention, we do have our Dream Seekers youth group. So since our youth group has kind of gone through a little bit of like name changes and like age ranges now, so we do offer youth group services for anyone over the age of 5, all the way up until the age of 24. So it's a big collaboration really amongst our agency, but really between our behavioral health department and our community wellness departments. And we kind of focus on helping the youth balance their emotional, their mental, their spiritual, and their physical health, and kind of making the point of one of these healths is not more important than the other. To be a well-rounded person, to really do what you need to be doing, you need to make sure that you're taking care of yourself in all aspects of your life, as well as through using guest speakers and teachings to come in. Like we offered like a financial literacy course for our youth, as well as like a social media, like how that takes a toll on your security and stuff like that as well too. You want to talk about that?
Yeah, we also have a youth advisory council here at the agency. So it's comprised of youth members in our community who kind of help model the direction of where they want Dream Seekers, the youth group, to go, how they want things to look in their community. Our youth council does help inform decisions about the agency, and we do value their input on a lot of things. Right now, I know that they are forming the new cohort for fall, I believe, late summer, early fall. So the Youth Advisory Council is a great way to have youth in the community who are interested in kind of getting that leadership experience. It's a great resume builder. They do kind of like a capstone community project. In past years, that's looked like a book drive and then it was actually this wonderful art kit that they sent out to community members that was these prompts that they came up with that tied to their culture, but also tied to COVID and isolation and helping those in our community kind of express themselves more artistically and talk about some of the big things that were happening in life. So that is available right now. We do have more information on that. And like I said, I do believe that they are accepting applications for this year.
Yeah. And we can also, I know last week I talked about I can send some materials and stuff over. The art kit that our Youth Advisory Council put together, I can also send that over to you guys as well, if you'd like.
That would be great, Don.
So now we're going to kind of move into some more of the professional, I guess you could say, terms of suicide prevention. So talking about some of our, we call them gatekeeper trainings. So if you were here with us last week, I kind of touched briefly on Living Work Starts. So it's a 90-minute fully virtual self-paced for anyone over 13. We do offer this for free through our agency. So if that's something that you're interested in, at the end, we'll have our emails there. You can always send us an email and we'll get you set up with a link. This is also a great training for other students as well. If they're interested in that, like we said, it's all only requirement is 13 and up. There's no type of formal training needed, no type of experience needed beforehand. So we're going to go ahead and move on to our youth mental health first aid. So we do offer this through our agency as well. So this one is a little bit more, it's a 4-hour virtual training, or it can be done in person as well. And this training is kind of designed for really anyone who's working with youth on any type of level or interacts with them. So this is like the next step up that's really good for teachers, even students, if you have friends and stuff like that, you know, you want to learn a little bit more about, you know, why people feel the way they do. This is a really good one. And this actually goes over like a step action plan on how to help someone who may be in crisis or may be out of crisis as well.
So the next one is Safe Talk. Oh, and I will add that youth mental health first aid can be done in person or virtually. Safe Talk, however, is only in person. So this is part of the Living Works kind of suite of programs. So the beginning, the foundation would be that START program, which is the only virtual one that they offer. However, we are Safe Talk trainers, myself and Adon. We love Safe Talk, clearly. This is also a 4-hour training, so half a day, and it's really kind of that introduction, baseline, introducing, working through a suicide intervention, asking that question about suicide, looking for those signs, but then also really tying into the community resources that you have around you who can help with a full suicide intervention. So Safe Talk stands for suicide alertness for everyone, and that's really something like a cornerstone of the program that we believe everyone can learn to be suicide alert. They can walk through these steps without being a mental health professional, of talking to someone who is having suicidal thoughts and can help them keep safe and get them to someone who can kind of do that full intervention of a safety plan or whatever that may look like. Safe Talk, we do offer for little to no cost to like partnering agencies. So we have trained high schoolers, we've trained teachers, we've trained casino staff. I mean, Safe Talk really can be applicable to anyone. The only requirement is that they do be 15 and up.
Yeah.
15 and up.
And if they're 15 to 18, we do have to have a signature from a parent or guardian.
And so the next program is actually going to be kind of like the one up step, which is called Assist. And Assist is a really intense 2-day, 2 full 8-hour days, so 16 hours total. And this teaches you how to do a full suicide intervention. So we don't believe that you have to be a clinician or a therapist to be able to do a full suicide intervention. Assist is really for those folks who want to go further and deeper and help really make an impact and be the person that people turn to if they know someone is having thoughts of suicide. So you're going to, again, work to identify those people, get an understanding of their reasons for wanting to die and for wanting to live, but then also helping develop a safety plan based on kind of their level of risk, the follow-up that you'll do with that, and really becoming a cornerstone in your community. Like we said, that you can be a referral of sorts for those who are identifying people with thoughts of suicide or the people with thoughts themselves. So we also love Assist. It's very intense, but a really wonderful, beautiful program that really teaches the foundation of becoming someone that anyone can turn to in your community when they're thinking of suicide.
And I believe this one is this one 16 and up, or is it 18?
Assist is 16 and up. We have had students take it before, and as I said, it is quite intense. But yes, you can be 16 and up and take this training.
So kind of moving along with what we do specifically with our program, we do offer our hope and wellness screening. So it's comprised of a few like clinical screenings that screen for depression and anxiety, as well as substance misuse, alcohol misuse. Really our main focus with this is we screen youth, like once again, 10 to 24. And if they do screen positive, depending on what it is, we get them connected with local resources to help best suit them. So obviously, if someone screens positive for, depression and anxiety, we're not going to get them connected with resources for being homeless shelters and food banks. It's really a part of our thing of making sure that we're referring youth to services that are tailored to them as well as culturally appropriate too. A little bit of background on the screening. So the screening was developed by staff here at AIHS, as well as University of Michigan School of Social Work. They kind of worked together probably about 3 years before the screening has been around, and it's been around since 2011. A recent addition to the screening is we work with our Youth Advisory Council to actually comprise like our wrap-up questions of things that they wanted to hear. They wanted somebody to ask them that would have made them feel a little bit not better, but things that they wanted to hear or wanted to know. So once again, to kind of touch back on what I said on the last slide, so youth that are determined to be at risk, they're referred immediately to an on-site clinician. So if we're out in the community, we always have a clinician, at least one, with us on site. Then the clinician will assess, and if there's a need for an intervention, safety planning, anything like that, we get them referred right then and there. If we're able to, we will refer them to us. We had a case of that 2 weeks ago. We were in Ann Arbor doing an event at Skyline High School, and we did have about three or four individuals who screened positive, and we were able to make them appointments and get them into our behavioral health services the following week. And then obviously, if we're able to, we do refer them to some of our traditional ceremonies and teachings that we offer here throughout the agency as well. And youth are also able to elect whether they would like a follow-up call from us or Common Ground we work with a lot. Did you have anything that you wanted to add?
No, we just, basically reiterating the safety of these screenings. We always want the youth to feel safe. We make sure that they know that these screenings are confidential, and really just providing them all the resources that they might need.
So did anyone have, well, first, thank you for having us again. Did anyone have any specific questions in regards to any of the trainings that we may have talked about? Anything specifically on like a cultural aspect, really just any type of questions, all
Do
together.
you guys have any questions? You do have the ability to unmute and ask, or you can type in the chat box what your question would be. You guys, I have a question. So if you have a student that is depressed, and struggling and having issues, and what would be the signs that you look for from them that would indicate that they're leaning towards suicide?
So a big one that we talk about like in our safe talk trainings and assistance stuff, big one is like isolation, or kind of like a detachment towards everything. So if you notice that this student is, say, coming to class less and less, or they're not actively participating in class, or they're just not coming to school at all in general, that could be a big indicator.
I think something else that we also emphasize in Safe Talk, but in general, is we talk about kind of the warning signs, which we have a language shift to called invitations now, and that the invitations that someone is giving off that they might be having thoughts. And I would say that the biggest thing that we try and reiterate is that you guys will know like the baseline of those people in your life. So while isolation can be a huge factor in students, if you have a student who's normally pretty isolated to begin with, and they kind of like their alone time, and you see like a marked change in that baseline of now they're like suddenly like very social and wanting to like make a lot of plans that typically, they kind of want to be on their own, that could be an indicator that they are trying to make some connections because they're like in a very dark place and are struggling, plans that they don't intend to keep, something like that. So knowing the people in your lives, the students in your lives, and knowing kind of what their baseline is, when you see that like marked difference off of how they normally behave, we always say it's safer to ask about suicide and it not be about that than for you never to ask and it is about suicide. So we really encourage that open and honest conversation about it, and asking very directly, are you having thoughts of suicide? Even if you just have a sneaking suspicion, to just kind of always ask. And we'd rather it not be about it, like we said, but just to ask and be sure.
Yeah, and we do touch a little bit once I'm like, as in Safe Talk, back in the training too, we also do touch base, and like Taylor said, we'd rather ask and it not be versus not ask and it is. But ultimately what you do when you do ask and say it might not be, you ultimately create a safe space and let that student know that you can be a safe connection, that you're willing to talk about suicide, and that it's not, like train of thought just went out the window.
Well, yeah, no, addressing just like the stigma around it for sure. And if it's not about suicide, then great. Your students or your friends or your family just know that you are a safe person to talk to if it ever does become that spot.
So let me ask this question. What if you see a person, whether it's a student or a family member or friend, that is, exhibiting those signs, and you say, hey, have you thought about harming yourself, in any way? Does that conversation create that safe environment, or does it make that person, oh, okay, I can't talk to that individual anymore because they figured out, what's going on with me? In other words, I'm saying, how do you know that questioning or inquiring is not pushing them further away, but drawing you nearer to them?
So sorry, it's like I'm not laughing because of the question. It's funny because everything that you're asking we go over in our training and we're like, ah yes, this we're like, we can get you signed up for Safe Talk. But once again, what we talk about in the training is that, humans, I mean, we're not as gullible as most people think. If I asked you to think about the most valuable item that you have, and it doesn't have to be monetary, the thing that you think of the most, what would that thing be?
My peace.
Okay, I have no peace. Can I have yours?
Absolutely. And let me show you how to get it.
No, you're supposed to say no. But ultimately, if I was to ask you, like, I really like your necklace. Can I have it right now? I mean, more than likely, you're going to tell me no. But
Right.
did me asking you, can I have your necklace, did that make you think like, oh man, I'm about to give this person that I've seen twice my necklace? And it's like, most of the time it's no. We have had a couple people who are like, yeah, you want this necklace? I can get another one. But ultimately, what it boils down to is us as humans, we're not as gullible as everybody thinks we are. And asking that question is not going to put that thought there if it's already there.
Okay.
So ultimately, it comes down to people who may be expressing invitations of suicide and things like that. A lot of times they don't necessarily want to die, they want help living.
Okay. That's really good to know.
Yeah. So it comes down to, we'd rather, ask. And if that person is having thoughts, then hey, we can get them connected and help them keep themselves safe. But if they're not, I'd rather someone be mad at me for the next 2 days because I asked them and they weren't, than I didn't ask and then we lose that youth. So
That is really helpful to know and understand, because you don't really know their state of mind, and you certainly don't want to be the cause of anything bad happening. But as you pointed out, you're not implanting anything that wasn't already there. So that is really good to know, that when you see someone that is having issues and struggling, the conversation is not off limits, because if it was that extreme where they are considering harming, it's not because of what you said, it's because that's what they were going to do in the first place.
yeah, and that's why Taylor had mentioned too that we've kind of tried to make this language shift away from using warning signs and kind of referring to them as invitations, is because when you think about a warning sign, you think, I'll turn away, like, go the opposite way, proceed with caution, versus when you think about, like, I got an invitation to this party, someone's inviting you to come in, so these people are expressing invitations and they're in a sense inviting you in to ask about that.
Good deal. There's a question in the chat that goes, what can we do if we approach someone with our concerns, but they deny having thoughts of suicide, even though their behavior seems to have many red flags?
Yeah, so you guys are really just having us walk through the entire Safe Talk model. This is a really common concern though. And it's that, even if you directly ask someone and you don't believe their answer, you ask that direct question, are you thinking about suicide? And what we try and teach in Safe Talk is using those invitations to really kind of make your point of why you're asking. So we always want to ask them directly about suicide. We don't ever want there to be kind of like a gray area of like, oh, are you thinking you're doing something silly, right? Because it's not silly to them. It's very serious. It's life and death for them. But when you do ask directly about suicide, you include those invitations in your language. So I won't just go up to a random person and be like, Adon, are you thinking of suicide? Right? Yeah. There's not a lot of impact in that statement. But if I walk up to Adon and I'm like, hey, Adon, I've noticed that you have been missing work lately. You don't come out and hang out on our typical Friday nights anymore. I know you're going through some really big life changes right now. Are you thinking about suicide?
And when you ask directly in that way, it kind of shows the person, once again, like Taylor said, that you're not just asking out of the blue. Like, you are taking the invitations that they're exhibiting and really letting them know, like, hey, like, I'm noticing, like, this is what's going on. Like, I'm not just asking you to ask.
So that's kind of the big piece of definitely noticing their thoughts, and that's a huge part, is kind of seeing those red flags and warning signs, invitations, but then using that to incorporate in their ask. So like saying to them, like, hey, this is what I've been noticing, and this is why I've been asking you. And we find almost always, very often, people are honest about their thoughts. Again, we believe that people who are having thoughts of suicide want that help, and that are giving those invitations off because they want to receive that help. And so if you are directly asking them, if you are saying, hey, I've noticed all these signs, but they're denying it, and you do keep circling back, you do keep saying, this is a safe environment, I want to know your answer, I care about what your answer is going to be, then we always teach participants in Safe Talk that you're going to move directly to keep them safe. At this point, if you have noticed these signs, you notice things are off, you really do not believe that they aren't thinking about it, you're going to kind of call in backup, per se, and get them directly to a professional who's going to help them more than you can. They might not be willing to open up to you for whatever reason, but taking that youth, connecting that youth immediately to a therapist, a crisis line, a school counselor, anything like that is really, because we don't know for sure. And if they're being kind of wishy-washy with you, they're not being honest with you, you don't believe their answer, we're all humans, we have a gut instinct, and if your gut instinct is telling you suicide, move them directly to keeping them safe. Again, they can be mad at you for a week, a year, the rest of your life, but if it saves their life because they truly were having thoughts of suicide, we would much rather have someone be mad at us than for them to harm themselves.
And so then handing them off to that next phase would be either some sort of counseling or hotline that could address the issue more aggressively than, I guess, I would, correct?
Yeah.
Yeah, and that's something,
sorry, go ahead.
That's something we really emphasize in Safe Talk, is like, it's not anyone's job to do kind of that full suicide intervention. It's not anyone's job to be a therapist. We know everyone is busy, everyone has their own lives, everyone has their own jobs, their responsibilities. You guys as educators have so much on your plate that we're not asking you guys to be therapists at all, and that is not the role of Safe Talk. If you're interested in doing a SIS, the kind of more in-depth thing, totally fine, but just being alert to suicide and noticing those warning signs and knowing how to connect them to someone who can do that full intervention, who can sit down, who can talk about medications, who can talk about safety plans, who can talk about kind of their reasons for wanting to die. We're not expecting you guys to like be that therapist and sit with a youth for 2 hours while they like pour their heart out, and you're like, there's so much to unpack here, where do I even begin with? But just kind of being that bridge that connects the people that you know most in your life, being alert that suicide, is not as uncommon as we think it is, what it might look like in people around you, and then connecting them to that person who can do way more of the work.
Okay, good deal. You guys, you got any more questions? Comments?
And then I think one last thing that I'm going to add quickly too is, I know that you guys are fully virtual, right? There's no like campus or anything like that where they come.
Well, no, we do have campuses where they can come in and receive tutoring and things like that.
Okay, So I know in some of like the public schools here in Detroit, I believe across the state of Michigan, it's now mandated that every student ID has the lifeline printed on the back of it. So that's the big 1-800-273-8255. But a quick one now that's working is 988, and that will patch you directly to the prevention hotline. So similar to 911, the Governor's Commission for Suicide Prevention has been looking at different ways to get access to the prevention line if you're in immediate emergency, without having to remember the whole number. And so it's 988, like you call 911 for, you know, a medical emergency, or if you need the police, anything like that. So dialing 988 will put you right through to the prevention hotline.
And 988 is a really good instance for, like Lisa said, if you are kind of still having those concerns because they are not willing to admit that they have thoughts right now, that 988 is right there. There's also the crisis text line, which is 741-741. We know a lot of kids like to text more than they like to call. So that text line is also there to immediately connect them, and really connect you and them if you are kind of trying to do a bit of an intervention. You want to stay there with that youth and help connect them over to that other person. So keeping 988 in your phone, keeping the 741 readily available. If you are worried about someone, you know, hey, I'm worried about you, I have this number that we can call together, and having that be an available resource 24/7.
Okay, good deal. Well, thank you so much, Taylor and Adon. We greatly appreciate your time. It was great presentation, a lot of excellent information that, you know, we can utilize throughout our daily workload when dealing with students, as well as family, neighbors, friends, you know, because it is really good to know what signs to look for, because you don't know what signs to look for, and you don't know how safe a conversation, you know, may or may not be. And this was really good to find out that even though it's not necessarily an easy conversation, it's not an off limits, because it's better to do it and not need to do it than to not have done it, you know. Oh, I wish I, you know, had said this much, you know. So that was really good. Thank you, guys.
Thank you for having us.
Oh, great, great. And thanks everyone for joining. Everybody have a great day. Get out and enjoy that beautiful sunshine. Bye, you guys.
Bye. Have a good one.
Thank you.